Joining me again is my guest co-host today, Vernon Jordan. Also joining me now is Republican Congressman from Arizona, Jeff Flake. Congressman Flake, good to see you.
Thanks for having me. Thanks.
Congressman, good morning.
Good morning.
Congressman, now I know that you've worked with President Obama before on some other issues, namely immigration. Do you think the GOP is being as constructive and cooperative as it could be? Not necessarily agreeing with everything, but constructive on the health care issue.
Oh, you bet. We've offered a lot of solutions on this, and we can do things that could keep the economy running and also improve the quality of health care and control costs. But instead, we're getting something that simply is not going to improve the economy. It's going to be a major detriment to job creation, and that's why Republicans are concerned about it.
Congressman, as you look forward, if the president were to come forward and say that I'm willing to add a number of things to this, I'm willing to add the taxing of some of the benefits that John McCain called for, maybe a couple of other things, is there a world in which you could conceive of voting for a bill that the president supports, or is the president, as some Democrats suggest, wasting his time trying to get a bipartisan deal done?
Well, it isn't a matter so much of adding a few Republican ideas. It's taking away some of the just terrible ideas that are contained in the bill right now, like taxing high-income earners a lot more. And most of those who pay in the upper brackets that would be hit hard with its tax are small businesses. And the last thing you want to do, particularly in a recession, is hit them harder. So I think it's more an issue of what would have to come out of the bill. Also, the so-called public option, which would simply drive people out of their insurance that they already have. And so things like that simply need to come out of the bill.
Can you tell us anything about how your sitting on the Foreign Affairs Committee has influenced your politics, your votes in the Congress? You spent some time in Africa, for which you're to be commended. How have these experiences affected your view of politics in this country?
Well, I think on a number of fronts. I appreciate you mentioning it. Yeah, I did spend about 3 years in Southern Africa. It's affected how I view economic sanctions, for example. I'm not a fan. I think that we ought to change our policy regarding Cuba. Every American ought to be allowed to travel to Cuba. And that's one area where I agree strongly with the president on. Also,
well, you won't find much company in your party on that issue.
Oh, I think it's growing. I think that, and there are a lot of issues that I agree with the president on health care and some of the spending that's gone on. I'm afraid I have to part ways. We simply cannot sustain this level of spending, and the economy cannot grow when government is consuming such a share of GDP. But in terms of one other thing I should mention with regard to foreign policy experience and health care, one thing that we had in the 1990s was kind of a rosy view of health care in Canada, for example, and much of Europe. There's a lot of luster off that rose today. Canada, the system works partly because of its proximity to the U.S., and people could come here for MRIs and whatever they need, but certainly people don't point to Canada or some of the European countries like they used to as a model for health care reform.
Congressman Flake, thanks so much for joining us. Look forward to having you back again, sir.
Hey, thank you for having me.
Thank you.